In this video, we will talk about the CT scan findings in liver trauma, and we will try to grade them into various grades, okay, with the help of the CT scan images. So let's get started. So first, let me explain you the grades of the liver injury. There are 1, 2, 3, 4, and 5 grades. Okay, when subcapsular hematoma, it depends on the subcapsular hematoma and laceration. If subcapsular hematoma is less than 10% and laceration is less than 1 centimeter, it is grade 1. If subcapsular hematoma is 10 to 50 percentage, okay, or laceration is 1 to 3 centimeter, then we can call it as a grade 2. If laceration is involving more than 50, subcapsular hematoma involving more than 50 percentage, okay, or if laceration size is more than 3 centimeter, more than equal to 3 centimeter, then you can call it grade 3. Or if there is a active bleeding present, then also you can call it a grade 3. And in grade 4, there is 25 to 75 percentage of intra parenchymal disruption, okay, plus there can be bleeding also. And 5 means a shattered liver, okay, or hilum injury, vascular injury, or if more than 75 percentage of intraparenchymal disruption, okay. So let's try to correlate here various grades. Okay, this is the liver. You can see that there is a small laceration here and there is a fluid collection, that is the bleeding, okay, around the liver. So this laceration looks very small, it is less than 1 centimeter, so this is grade 1, right? Then you can see that there is a laceration in the right lobe of the liver and there is a fluid collection around, okay, which is bleeding. You can see that this laceration is quite big, but it is not that big, so this is grade 2 liver injury. Then what you can find here is, you can see that there is a hematoma here. Okay, can you see that there is a hematoma and there is an extravasation of the contrast, okay, in this part. So there is a hematoma, okay, which mostly looks, involving more than 50 percentage area, and there is also active bleeding there. There is a active bleeding. So this is grade 3 injury, okay. You can see that this is a liver, okay. There is this intraparenchymal hematoma and it is like ruptured, okay. You can see that it is ruptured and there is a bleeding, there is an intraperitoneal hemorrhage all around. So there is a large hematoma, okay, and intraparenchymal disruption, okay. So this mostly looks like more than 25 percentage involvement of the liver, okay. It is like, it is around 50 percentage approximately. So, and there is extravasation of blood here and there's an intraperitoneal hemorrhage, so it is grade 4 because I explained you what is grade 4. Grade 4 means 25 to 75 percentage of the intraparenchymal disruption plus active bleeding. So you can see here that there's an intraparenchymal hematoma and there's an extravasation of blood here, and this hematoma is ruptured. Okay, so it comprises of grade 4 category. Now you can see that there is a laceration here, okay, which is very deep, and there is bleeding here, okay, and you can see that this is the vessel, this is the hilum part, and there is a laceration extending into this hilum. So when hilum is involved, okay, you can tell that it is a high grade injury and it is a grade 5 injury. Now again, see that this is a liver. You can see here laceration, okay, in the left lobe. You can see that this liver is shattered, like it is involving more than 75% of the liver. Okay, there is an intraparenchymal hematoma, and there are vascular involvement also. You can see that the vessel is, there is a laceration, okay, in the hilum region, okay, and there are extravasation of the blood also. So you can call this as a grade 5 injury. Okay, this is mostly the portal vein. So yeah, that's all for this video. Hope you find this video helpful. So please don't forget to like, subscribe and share.